name is Marissa. Today I'm going to be doing 5 views on my patient's knee today. I'm going to do, the first 3 views are going to be in this bucky, which is the table bucky, and I'm going to be using 10 by 12s for those first 3 views. The first view is going to be AP knee, and then I'm also going to be doing an AP oblique knee, where it would be 45 degrees with medial rotation. And then the last one is going to be a medial lateral knee. I'm also going to be doing 2 other views. The first view is the Baclair view. It's to check the intercondylar fossa. This will be on an 8 by 10, and that will be free from any bucky. This next view I do will also be free from the bucky, and is a tangential patella view, and that's with free from the bucky as well. So first, to set up the room, I have my, well, I'll only be having one of these in the room at the time, but I'm going to first detent the tube to the patient table. I'm going to press detent. Now I am going to, there we go. Oh, there it is. So now it's to the table. Now I check my body to ensure that I am lined up, which I am not. So I'm going to go ahead and do that. There we go. Now it's lined up. So now that I have it open, I'm going to get ready to do my first view. This little line here shows that I'm going to do it portrait. So the patient's head's going to be on this side. So I'm going to go ahead and point this in the patient's head direction. So I'm going to slide this in and make sure it's nice and lined up. And then just to be on the safe side, I'm going to ensure that it's a straight line. Needs to be a little bit. There we go. Okay. Slide it right in. So now it's all ready for the first view. Okay. So also, I'm going to set the technique. For the knees, they vary, but they're about 65 to 70 kV, and it could be anywhere from 3 to 6 mass depending on what view we are doing and the patient size. Since we are in the bucky for the first view, I'm going to set it up for a 70 kV, which is right here, major kV, so I'm going to go ahead and put it to 70. And then over here, I'm going to choose a 4 mass, only because it's a little on the hotter side due to the fact that we are in the bucky. So I find 4, I get 400 MA, and I come over here and I get 0.01 times. So this is at 400 MA, and 0.01. And now I'm ready to go get my patient. Okay, so now that my tube is detented, I have my first patient here, and it's all lined up. I'm going to go get my patient. Dustin?
Yes.
Hi, I'm Marissa. I'm with the radiology department, and I'll be taking your images today. Can I get your last name and your date of birth?
Nelson, 10780.
Okay, great. And I have to ask before we get started, is there any way that you can be pregnant?
No.
Okay. And so it says that we're going to be taking some images of your knee. Which knee is it?
My right knee.
What happened?
I hurt playing basketball.
Playing basketball? When did you hurt it?
Earlier today.
Earlier today. And can you point to where it hurts the most?
All around, it's a little swollen. So.
It's a little swollen? Okay. Do you mind just go ahead and lie down with your head on the pillow? Watch your head here. There we go. All right. And these look like they're soft pants and easy to roll up. Could you roll them up for me? Thank you. All right. So I'm going to start with the AP knee. For the AP and my next view, which will be oblique, there's a ASIS measurement from that to the table, and he looks like he's between 19 and 24, which there's no angle on it between 19 and 24. If he was to be less than 19, I would do 3 to 5 inches towards his feet, cotted. And if he was to be greater than 24, I would do 3 to 5 inches cephalad. So neither this view or my next view, which is the oblique, would I do an angle. I'm going to go perpendicular. Okay, so we'll get started. I'm going to go ahead and start by raising the table. So hang on just a sec, a little bit of a roll. There we go. Before we get started, I'm also going to shield you now that you're easier to put this on because you're higher. Sorry, it's a little heavy. And I also have this to go around your neck. There you go. Sorry if it's uncomfortable. Won't be long. All right. Okay, so I'm going to go ahead and I'm going to aim the center beam between the epicondyles of the femur and just put there we go, so you can see better. Put it between the epicondyles of the femur and then put the central ray just about a ½ inch below the apex of the patella. Make sure there's no rotation by feeling those epicondyles, making sure they're parallel with the table. I'm going to collimate, so it's just about 2 inches below and above. There we go. I'm going to grab my right marker, put it on there on the lateral side. That looks great right there. All right, just hold still. My technique is going to be about, let's see here, 70 at 4, because I am in the bucky and I want it a little locked. Okay, just hold still. Beep. Okay. For my next view, I'm also going to do a 10 by 12. I'm going to switch this out. I'm going to have the bar towards his head. I'm going to rise. This out of the view so there's no double exposure. Okay. So now I'm going to also center between the epicondyles of the femur and the tibia, the condyles, between mid, and then I'm also going to go about a ½ inch below the apex of the patella. So I'm going to have you rotate your leg towards your toe, and then that looks great. It's about a 45-degree angle. I'm going to recenter since we have moved it a little. I'm going to feel the apex without applying too much pressure, just so I can see. I'm about a ½ inch below. I'm going to collimate to add a little forward. There we go. My right marker is on the right side. It's out of the view. I'm going to keep my technique at 70 to 4. So it'll be just a minute. Hang on. Beep. Okay. Now for my last view, there is no ASIS measurement that would be involved with this, but I will go ahead and angle my beam 5 to 7 cephalad so I can get into the joint space, and I'll show you. Rotate to your right side on your right hip. We're going to bring that knee down on the table, and the patella is perpendicular with the board. I'm going to go ahead and put this back on top of him so he is protected. There you go. That should do it. Sorry if that's uncomfortable. So there's his knee. I'm going to support his knee too. And let's see. Now to use what I have. Down the wedge. So I'm going to put this just underneath his foot a little bit to rotate that knee so it is perfectly perpendicular. Now his leg is at a 20 to 30-degree angle. I'm going to feel his medial epicondyle. I'm going to go 1 inch below, and that is where I'm centering. So there's his knee. And a little below, a little above. I am going to increase my technique to about 70 at 5 because I increased my thickness. And here's my right marker. Before I get started, actually, I'm going to 5 to 7, which is this here. beam to the bucky, make sure I have the anatomy on there. I'm going to bring it back up. All right. Put that in. We're all ready to go for our next view. Beep. Okay. All right, Dustin, I'm going to run those 3 images. We still have 2 more images, but just hang tight.
Okay.
Let me move that. And I'll be right back. Okay, those images looked good, so we will continue. The next 2 images are not going to be in the bucky. They're going to be free of the bucky. So, and my technique is going to be about 65, 4 to 5, depending on the thickness of his leg. He's pretty lean. I'll do 65 at 4 for both of them. Okay, so those images look great. I'm going to go ahead and put that lead back on you. We just have 2 more. There we go. Let me just do that. Sorry, a little lower. Okay, so I'm going to have him bend his knee about 60 degrees. That looks great. And this first view, I'm going to do an AP axial view of the intercondylar fossa, which is also known as the Bouclair method. So his leg is at a 60-degree angle. Now I'm going to move this down. Get that situated there. I'm going to grab an 8x10 film, and then I'm going to build up the IR to his kneecap, because it's going to go underneath posterior portion of his knee. So I'm going to slide this under. This is going towards his right side. I'm going to sort of push it a little bit there. That looks pretty good. The angle, the central ray is going to be perpendicular with the angle of the tibia. I'm going to step back and look. I'm going to do a little more. I like that. Okay. So I'm going to bring it down. A little bit. Make sure I have my distance. I don't want to get too close. That looks better. I like that distance. All right, so here is my central ray. I'm going to go between the epicondyles, and I'm going to go about right below the apex of the patella. This could be a problem because I'm going to be shooting off the film, so I might drop his leg just a little bit. That looks good. And then that means I'm going to drop my ankle just a little bit. It's important to take your time and get exactly what you need. All right, so now I look. There's my line, so that looks good. Get him onto the film. Make sure that he's on the film. Super perfectionist. Looks good. All right. So I have all the anatomy. I'm centered below the apex of the patella and between the epicondyles. I'm going to grab my right marker and put it on his right lateral side. To increase my collimation to make sure I include my marker, but not too much that I'm overexposing. And I'm going to go shoot that film at 70 at 4. Please hold still. Beep. Okay, I like that image. So now the next image we take is going to be a tangential patella. With this, I'm going to actually incorporate my patient into helping me. I'm gonna get this over and down so okay, so for this view, I'm going to go ahead and bend his knee about 60 degrees. I'm going to take my IR, I'm going to place it behind his kneecap, because what I'm doing is centering the central ray perpendicular between the patellar femoral joint space. We're trying to take the patella and make it free of any superimposition. So if you don't mind leaning up and just holding this here. Is that okay? I'm going to make sure this is on, considering it's
There we go.
okay. And I'm going to use, actually looks pretty good. So I'm going to enter, there's 40. I'm going to enter just below the apex. That looks great. I see perfectly. I'm going to move his fingers just a little bit. Thank you. You've been so helpful. Let's go right. I'm going to call me a little more. Make sure I'm not overexposing unnecessarily towards his face. And that looks great. So I'm going to go ahead and shoot that at 70 at 4. Beep. Okay, thank you so much. You can relax. I'm going to go run those images, and we're just hang tight. Let me take off all this lead, and I'll be right back. So now I have, I put Dustin into the computer. I ordered his name up, and I put the session number and all his information. And the images we did was lower extremity, and we did a knee. So we did the AP, and then we did the lateral, and we did the, it was an internal oblique, and we did the sunrise and the tunnel. All right, so now I'm going to scan my images. Here is the AP, here is the lateral, and here's the knee oblique internal. Now the sunrise is also known as the set of gas that we did, and the tunnel is the Beclaire. So here is the sunrise, and here's the tunnel. Now we're going to go ahead and run these images in the reader.
Huh?
This
Mine's up there.
Okay, so there's
You heard me way on
At the
top.
top.
yeah, and now it might take a second because we only have 4 for the reader, so we'll wait for this one. And here are our images. So these are our images. These are our first 3 images of the knee. These were the images that were done in the Bucky. We have the AP knee, where the patella is superimposed on the femur. The epicondyles, or the condyles, are with no rotation. Neither are magnified. They're perfectly straight. There's a great joint space between the femur and the tibia. Each joint space, inner space, is of about equal distance, which is showing no rotation. The leg is completely extended, and I have my marker present. For this view, which was the medial oblique, you can tell that it's medial oblique because the patella has rotated to the medial side, showing enlarged magnification of the lateral condyle. There is great joint space with the rotation. The leg is all again extended, and there is that medial rotation opens up the proximal fibular tibial joint, which looks great as well, and my marker is present. For the next view, the leg is bent at 20 to 30 degree angle. The joint space between the patellofemoral joint is open. This is a great view of that.
The epicondyles are superimposed on one another, as well as there is joint space present, which looks great. This leg is also straight because the fibula just slightly superimposes at the proximal joint from the posterior part of the tibia, so that looks great as well. And my marker's on there, so this looks like 3 great films. Okay, so these are our 2 remaining views of the knee. These 2 views were not done in the bucky, these were done outside the bucky. The first view we have is the intercondylar fossa. It's the AP axial view. It's also known as the Beclaire method. So because it's the intercondylar fossa view, there's the intercondylar fossa completely open and it looks great. We also show the intercondylar eminence beautifully there, as well as the tibial plateaus are present. The joint space is open, and since the knee is flexed, you could see the inferior side of the condyles, the femoral condyles, which look great there. Because it is due to the view, we angle the patella off the joint, so the apex is no longer covering the knee space. It's not superimposing the knee space, which is great. And this is a great view, and there's my marker. And great collimation a little above and a little below. All right, for this next view, I have the tangential patella view. This is showing there's a soft tissue, the dome, and it's showing the patellofemoral joint open beautifully, so all the way through, and it's showing the patella in profile, so it's looking like it's suspended in air, and my marker's over there showing that it's the left knee. So that is also known as the Settegast method. All right, and those are the remaining views.